welcome to Prescription Nurse, your daily dose to living well. I'm Chandra Eldridge, your nurse consultant. And thank you for watching today's video. What's your daily dose? Well, in today's video segment, I'm going to be talking to you about something I created called Nursing Notes. And Nursing Notes is just a quick reminder of tips that you can do to help you have a successful shift, to help you build collaborative relationships with other team members and ancillary staff, and also help you move up the career ladder and wow your boss all at the same time. And guys, the coolest thing about Nursing Notes is they can be applied to any profession that you're in. So if you're not in nursing, don't worry. All of these principles and tips are applicable to whatever job you're in. So I'm going to dive right in, but before I do, I'm just going to start off by telling you a little bit about myself. I've been a nurse for 14 years in various roles, various specialties. I've done med-surg, ICU, IMU, ER, observation, and most of that time I've spent in a leadership role where there's charge nurse manager. I'm currently working as a nursing director, and I'm also the founder and creator of Prescription Nurse. So with that being said, I want to give back to the nursing profession by elevating nurses and sharing my expertise and just helping nurses be the best that they can be so that our patients get the best care possible. So with that being said, let's dive right in. And the first thing you want to do is you want to listen to your patients. Listening to your patients, that is so important because that's the reason why we are in nursing, and that is to help others. And in order to help someone, you have to listen to what they need. So the key is listening with the intent to understand and not to respond and formulate your own opinion of what you think the patient wants. And another thing is we want to be advocates for our patients. So in order to advocate effectively for your patient, you have to listen to them. In order to communicate effectively your patient's needs to the physician, you have to listen to them. So listen to your patients. And the next thing you want to do is show interest in your work. And that's really simple. That is show up, be on time, be present in your work. Make sure that your scrubs are clean, ironed, and pressed, and that you are professional. Show interest, be engaged. The next thing you want to do is you want to take ownership. So if you notice that there is a breakdown in a process or there's a problem on the unit, take ownership of that problem. Instead of waiting for someone else to come up with a solution or for your leadership to solve the problem, you come up with the solution and be innovative when you come up with that solution. That's taking ownership. If you see something that needs to be done, take ownership and do it. That's going to help keep you engaged and reduce burnout. And the next thing you want to do is you want to strive for excellence. Striving for excellence just means being engaged. It means being abreast on best practice and practicing best practice so that your patients get the best quality outcomes. Striving for excellence is joining a professional nursing organization, learning everything that you can learn and applying it the best way for the best outcomes for our patients. And lastly, you want to help others do the same. So when you help other people, guess what? You get better. It's so rewarding to help other people and share what you've learned because you get something out of it as well. You get to perfect your craft. So help others do the same. Help others strive for excellence. Help others take ownership. Help others show interest in the work. And that's going to help build that collaborative team that's going to help reduce burnout and your patients get the best care possible. So when you help others, you get help. I hope that you found these tips or you find these tips useful and of value. And if so, you can head over to my website at www.prescriptionnurse.com where I have other tips and other health information so that you can be well and that you do a great job taking care of your patients. If you found value in this video, please like, comment, or share, and I would love any feedback of any other tips or any other questions you may have to help you be successful in nursing and just day-to-day have a successful shift. So thank you for watching, and again, stay tuned to Prescription Nurse. Now that's your daily dose.